Have you ever heard of a condition that subtly alters the landscape of your optic nerve? Welcome to the world of tilted disc syndrome, a fascinating and often benign anomaly affecting the eye. In this video, we'll explore what tilted disc syndrome is, its causes, symptoms, diagnosis, and what you can expect if you're diagnosed with it. The exact cause of tilted disc syndrome remains a bit of a mystery. However, it's generally believed to be a congenital condition, meaning it's present from birth. It arises during the development of the eye, specifically when the optic nerve head, the point where the optic nerve connects to the retina, forms at an angle. Genetic factors might also play a role, though a specific gene hasn't been identified. Some cases are associated with other ocular conditions, but in many instances, it appears spontaneously with no clear underlying cause. At its core, tilted disc syndrome involves an abnormal orientation of the optic disc. Typically, the optic disc is roughly circular or oval. In tilted disc syndrome, it's tilted often inferiorly as downwards and nasally towards the nose. This tilting can lead to a crescent-shaped area of hypopigmentation, or paleness, on the temporal sides towards the ear of the disc. The tilted position can also affect the emergence of blood vessels from the optic disc, giving them a distorted or atypical appearance. While this structural anomaly can cause visual field defects, the degree of vision impairment varies significantly from person to person. Tilted disc syndrome isn't particularly rare, but precise prevalence figures are difficult to pinpoint because many individuals with the condition are asymptomatic and never diagnosed. It's generally considered to be more common in individuals with myopia or nearsightedness. There does not seem to be a significant predilection for any specific race or gender. Many individuals with tilted disc syndrome experience no symptoms whatsoever. The condition is often discovered during a routine eye exam. When symptoms do occur, they can include blurred vision, particularly in individuals with high myopia, and visual field defects. These visual field defects, if present, are usually in the lower nasal quadrant, but they don't always affect central vision. In some cases, tilted disc syndrome can mimic other optic nerve disorders, leading to diagnostic challenges. Diagnosis of tilted disc syndrome relies on a comprehensive eye examination. This includes visual acuity testing, refraction to assess refractive error, and importantly, a dilated fundus examination. During the dilated fundus examination, the ophthalmologist or optometrist can directly visualize the optic disc and identify the characteristic tilted appearance. Additional diagnostic tests, such as visual field testing, optical coherence tomography (OCT), and fundus photography may be used to document the extent of tilting and to rule out other conditions, such as glaucoma, optic nerve drusen, or optic nerve hypoplasia. While tilted disc syndrome itself doesn't have distinct subtypes, it's important to consider its association with other conditions. It may be classified based on the severity of the tilt or the presence of associated visual field defects. Clinicians may also categorize it based on whether it is unilateral, affecting one eye, or bilateral, affecting both eyes. Furthermore, its presence alongside other conditions like myopia or astigmatism might influence classification or management. In most cases, tilted disc syndrome requires no specific treatment, especially if the individual is asymptomatic and has no significant visual field loss. Management focuses on regular monitoring and correction of any refractive errors, such as myopia or astigmatism, with glasses or contact lenses. If visual field defects are present and affect daily life, low vision aids or visual rehabilitation may be considered. It's important to have regular eye exams to monitor for any changes and to rule out other potential eye conditions. Because tilted disc syndrome is believed to be a congenital condition, there's currently no known way to prevent it. Prenatal care focused on overall maternal health can support healthy fetal development, but there's no specific intervention that can directly prevent tilted disc syndrome. Regular comprehensive eye exams, especially for children with a family history of eye conditions or high refractive errors, are crucial for early detection and management. The prognosis for individuals with tilted disc syndrome is generally excellent, especially if the condition is mild and asymptomatic. In most cases, the tilted optic disc remains stable over time, and vision remains unaffected. Recent research efforts are focused on better understanding the genetic factors that might contribute to the condition, and on developing more sensitive imaging techniques to detect subtle changes in the optic nerve. There is some research investigating the correlation between tilted disc syndrome and intracranial pressure. As our understanding of eye development and genetics advances, we can expect more insights into the etiology and management of tilted disc syndrome in the future. Remember, while the name might sound concerning, tilted disc syndrome is often a benign condition that can be managed with regular eye care.